This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Isofit Tablet is a hormonal therapy used to manage progesterone deficiency. It alleviates period cramps and manages symptoms of endometriosis and premenstrual syndrome. Indications and uses. This medication is indicated to relieve menstrual pain, manage symptoms associated with endometriosis, and treat premenstrual syndrome. Additionally, it supports overall female reproductive health and aids in addressing signs of menopause in postmenopausal women when used alongside estrogens. How it works. Isofit Tablet works by supplementing the body with sufficient levels of progesterone, improving the thickness of the uterine lining and alleviating symptoms associated with progesterone deficiency. Directions for use. Take the medication as advised by your physician. Swallow the tablet whole with a glass of water, do not crush or chew it. It can be taken with or without food, but consistency is key, so try to take it at the same time each day. The doctor will determine the appropriate dosage and duration based on individual health conditions and body weight. Possible side effects. Common side effects may include severe headaches, nausea, breast pain or tenderness, and irregular or heavy periods. Consult your healthcare provider if any of these symptoms worsen. Precautions and warnings. Prior to taking this medication, inform your doctor about any existing liver or kidney issues, unexpected bleeding, or a history of depression. It is contraindicated for those with certain tumors, heart diseases, or allergies to the ingredients. Caution is advised for adolescents and postmenopausal women, and monitoring is essential during treatment. FAQs. 1. What is Isofit Tablet used for? It is used for managing progesterone deficiency states. 2. How should it be taken? Swallow the tablet with water, do not chew or crush it. 3. What are the side effects? Common side effects include headaches and nausea. 4. Can I stop taking it if symptoms improve? No, do not stop unless advised by your doctor. 5. Is it safe for children? It should only be used in postpubertal females if prescribed. Thank you for watching. If you have any questions or suggestions, feel free to leave a comment below. Your feedback is important to us.